Good afternoon, everybody. Thank you for joining us for this afternoon's press conference on COVID-19. I am joined today by our Health Commissioner, Dr. Terraza, Police Commissioner Michael Harrison, Dr. Sharita Hill-Golden, and Dr. Panagis Galeasatos from Johns Hopkins, and Bishop James Nelson of Destiny Christian Church. Ensuring the health and well-being of Baltimore residents remains my top priority. I often say not only do we have world-class medical institutions here in Baltimore, but we have the medical institutions leading the global response to COVID-19 right here in our backyard. That is why I am excited to announce a new partnership today between the City of Baltimore and Johns Hopkins University in medicine that will advise houses of worship on how to reopen safely during the COVID-19 pandemic in accordance with best practices and public health data. The partnership will involve two components: a virtual educational session and one-on-one guidance to help Baltimore faith institutions comply with the city's public health mandates, learn about best practices, and receive resources. The virtual information session will include information about the latest CDC guidance, safety actions, health and hygiene practices, cleaning protocol, and guidance for monitoring the well-being of congregants. Additionally, the Mayor's Office, the Health Department, and Johns Hopkins University in Medicine are establishing a pilot program to pair health professionals directly with our faith institutions. These health professionals will perform building walkthroughs with interested houses of worship to provide individualized guidance for the Department of Health and Safety protocols for the congregants and staff. I'd like to now turn it over to our two guests from Johns Hopkins University in Medicine. First, we will hear from Dr. Sharita Hill-Golden, Vice President and Chief Diversity Officer for Johns Hopkins Medicine, and the McCormick Family Professor of Endocrinology and Metabolism, sorry about that. And she will be followed by Dr. Panagis Galeasatos, Assistant Professor in the Division of Pulmonary and Critical Care Medicine, co-chair of Johns Hopkins Hospital System Health Equity and in the Office of Diversity, Inclusion, and Health Equity, and co-director of Medicine for the Greater Good. Dr. Golden.
Hey, good afternoon, Mayor Scott, Commissioner Terraza, Bishop Nelson, and the Baltimore community. Johns Hopkins Medicine and University are proud to collaborate with the Mayor's Office of Neighborhoods and the Baltimore City Health Department on this vital COVID-19 education initiative. This initiative is part of a broader scope of work we have been leading, aimed at partnering with Baltimore City, faith leaders, and the community to bring relief to residents facing economic hardships during the pandemic and to provide information about COVID-19, vaccines, and testing. For so many, we have been longing for the moment we can gather together again. This is particularly hard for churchgoers who find healing in face-to-face fellowship. And so we are delighted to bring our medical and public health expertise to our faith partners to share information about the COVID-19 pandemic and vaccines as it evolves, as well as to provide guidance on approaches to safely reopening places of worship across the city and adapting our worship practices in the setting of the pandemic. Medical religious partnerships are imperative to improving the health of our communities. Faith institutions are trusted backbones and pillars in our society. Johns Hopkins has a long-standing, strong relationships with so many of these beacons of faith here in the Baltimore community, providing programs that improve the health of our citizens. One such recent program in collaboration with the city, Koinonia Baptist Church, Zion Baptist Church, and Southern Baptist Church provided vaccines directly to residents most in need. Together, we have vaccinated over 1,000 individuals as part of this collaboration. We will continue to partner with the city and faith-based institutions to ensure our residents have access to these needed and effective vaccines. This faith-based partnership will offer a virtual education session for faith leaders on how to safely reopen churches, synagogues, mosques, temples, and other faith-based centers. In addition, Johns Hopkins infection prevention experts will provide personalized guidance to individual houses of worship. While there are effective vaccines that are available, there are still 50,000 Americans being infected with COVID-19 daily. It is imperative that we remain committed to wearing masks, washing our hands regularly, and maintaining a safe distance from others, even in our places of worship. As the impact of the pandemic continues to grasp our city, it is our hope that this new education initiative will provide faith leaders and members of our places of worship with the guidance that can help keep our residents safe and limit the spread of COVID-19. Thank you, Mayor Scott, Dr. Duraza, and Bishop Nelson. We look forward to continuing our collaborations with the city on these essential initiatives. Thank you.
Thank you, Mayor. Thank you, colleagues. Thank you, Bishop. Thank you, Baltimore, for allowing us to be here today. Growing up in this city of Baltimore, there were a handful of things that I can look back and say, yes, that defines Baltimore. For me, it was my church. For others, it was their church or their temple or their synagogue or their mosque. Faith-based communities have been part of Baltimore for as long as Baltimore's been around. And they haven't been there just to help with worship services or spirituality, but they've helped allocate resources when people needed them. They've been there to help those who others would not help. Essentially, they have been there to help Baltimore be Baltimore at its best. And if we are to move past this pandemic and put it behind us, these medical religious partnerships will be the answer. I'm confident of that, and I've seen that. More specifically, if medicine is to reaffirm itself as a public trust, it must work with entities that have the public's trust. And for me, that's always been faith-based organizations. Over this past year, we've actually done a little bit of work with a variety of congregations, many of which Dr. Golden has mentioned earlier. Some of them have joined our weekly calls on Fridays to discuss COVID-19, specifically answering concerns that they had out in their community. Others have teamed up with us with what we call our congregational conversations around COVID. And during these times, these intimate Zoom meetings, the congregation, you could feel, is ready to step up and help their community. Right? They want to keep their neighbors safe, their families safe, their congregation safe. It is a blessing to see happen in real time. And during these conversations, they discuss everything, how to do an adult baptism to how to do a bris. Powerful, because they want to keep people safe, to allow their culture to maintain, but without ever having to fear COVID. And that's what excites us about this medical religious partnership moving forward. Specifically from my standpoint, I think doctors and nurses have been inappropriately categorized as frontline staff. We're not. If you have COVID and you're seeing me in the intensive care unit, I'm your last line of defense. Your front line are those who can promote health and prevent disease. And who's reaffirmed that to me over the last year have been faith-based organizations, taking in this information, disseminating out, getting the supplies they need, disseminating out, getting the vaccines into the arms. So we're excited as we move forward. To me, this medical religious partnership is a silver lining in a pandemic that's taken much from us. So I'm excited for this commitment, and Baltimore and Mayor, we're very excited to partner. Thank you so much.
Thank you. This partnership with Johns Hopkins University in Medicine is critical to ensuring our houses of worship have the resources they need to safely worship. And I'd like to now turn it over to Bishop James Nelson of Destiny Christian Church for a few words from our faith community. Bishop.
Thank you, Mayor. As the pastor of Destiny Christian Church, I want to first acknowledge and thank our mayor for his tireless leadership, especially during this time of this pandemic. And we celebrate and thank you for your leadership. Since the inception of this pandemic, Mayor Scott has prioritized the faith-based community during this COVID-19 season. And this partnership with Johns Hopkins and doctors that we are joining forces with to collaborate to help to get back to some sense of normalcy is of the utmost importance to our society. It is essential even to our houses of worship. as our good doctor has already expressed, that the faith-based community has been the backbone of this city, and we are standing in the front lines. We're not just places where we come to worship, but we've been the places to help meet needs, give food, give supplies, and now to be sites for vaccination. As houses of worship prepare for their reentry, partnering with the Baltimore City and Johns Hopkins Medicine and University is going to help lift the burden, even for organizations and places of worship that may not have the resources that others will have. As Destiny Christian Church, we have been very intentional to lead and follow the guidelines of our mayor and the stipulations put in our city to remain virtual in order to protect and help our constituents stay healthy during this time of this COVID-19. But I do want to say that we are excited about this global partnership. We're excited about these global health professionals. We're excited about this virtual learning in order to prepare ourselves to get back to some sense of normalcy in our worship experiences. And so every house of worship, please hear me, we will benefit from these virtual sessions in person and in this pilot. And I look forward to working with Mayor Scott, with Johns Hopkins, with Dr. Gordon, Dr. G, and the entire faith-based community. Thank you, Mayor.
Thank you, Bishop. We thank our faith institutions for continuing to find ways to not only worship safely during this pandemic, but as you've heard from the bishop and the doctors, for all that they've done throughout this pandemic, from feeding people to helping people figure out how to navigate and getting vaccines and testing and how to sign up for rental assistance. Our faith community in Baltimore has been there since the pandemic showed up on our doorstep, and we know they will be alongside us every step of the way. And we thank Johns Hopkins for being an essential partner as we continue to navigate this pandemic and find new ways of working and collaboration with each other. And now I'd like to turn it over to Dr. Jaraza to talk about where Baltimore City stands with COVID-19 and vaccinations. Dr. D.
Good afternoon, and thank you, Mayor Scott, for your steady leadership during this pandemic. I'd also like to thank our guests here today, Dr. Golden, Dr. G, and Bishop Nelson, as well as Johns Hopkins Medicine for their partnership and advocacy in keeping Baltimore City residents healthy and safe during this pandemic. Working with our houses of worship have been a priority for the health department throughout the pandemic. Ensuring that our faith institutions have the most up-to-date COVID-19 guidance and reopening best practices will continue to save lives. Especially as we are in the city's fourth wave, the importance of our faith-based organizations supporting the community remains paramount. Current city data shows daily case counts comparable to the highs we saw in November and December. Our daily new case count is approximately 247 new cases per day, with a total of 50,402 confirmed cases and 910 city residents having lost their lives to this pandemic. We are now averaging close to 3 deaths per day. Our percent positivity is 5.2%, indicative of widespread community transmission. Our intensive care units and acute care units capacity remain high at 87% and 85% respectively, and we continue to monitor for the potential to overwhelm our hospital systems. At this time, while we know that new case rates and hospitalizations are increasing, especially among our population under the age of 70, we believe that there are a few compounding factors contributing to this rapid rise in cases for a sustained period. Currently, the city has widespread community transmission, and it is safe to assume that people outside of your household are potential carriers of the novel coronavirus. Additionally, coronavirus variants are circulating throughout the Baltimore metro region. We have also seen increased mobility in city residents for the past few weeks. All of this is likely contributing to a faster increase in the rate of new cases. The good news is, as of today, 35% of city residents have gotten at least their first or single dose of vaccine, and almost 1/4 of city residents are considered to be fully vaccinated, having received either 1 dose of Johnson & Johnson or 2 doses of Pfizer or Moderna vaccine. As a reminder, you are fully vaccinated 2 weeks after your second dose in a 2-dose series, or 2 weeks after a single-dose vaccine. As I mentioned earlier, mobility, or the rate of people moving around Baltimore City, is elevated and is now approaching what it was in pre-pandemic times. It is likely that the public perception of the pandemic has shifted, possibly due to ever-increasing vaccination rates. We recognize that city residents are ready to return back to normal, and this rise in new cases may be attributed to a new type of COVID fatigue, where people are engaging in behaviors as if they've been vaccinated before they've actually received the vaccine. Even if you have been fully vaccinated, you should still be using proven harm reduction strategies to protect yourself and others, because the majority of the population remains unvaccinated at this time. Please continue all the same behaviors that have kept us safe to date: wearing a well-fitted mask over your nose and your mouth, keeping your distance, and avoiding crowds or large gatherings. Being fully vaccinated does provide certain benefits. You can safely gather with other fully vaccinated people in a private residence without wearing a mask, or with the single household of an unvaccinated individual in a private residence without wearing a mask, assuming no one in that household is high risk. I also want to take the time to encourage all residents over the age of 16 to get vaccinated as quickly as possible. Pre-registering for your appointment has now been made a lot easier via our new website, covax.baltimorecity.gov. Vaccines are available, and if you are interested in returning back to normal, get vaccinated and encourage your friends and families to get vaccinated too. If you have not been fully vaccinated, acting as if you have puts you and your family in danger, with particular concern around children under 16 who are not yet eligible for the vaccine. For much of the pandemic, we've cautioned against visiting older family members because of the high rates of COVID fatalities in our older population. Now, however, hospitalizations are increasing in those under the age of 70. The greatest number of COVID hospital admissions is now among people aged 50 to 59, followed by people aged 60 to 69 for late March and early April. Anyone who has not been vaccinated should be worried about the possibility of serious COVID disease. It's also important to note that children under the age of 16 do not yet have an approved vaccine. I therefore urge parents especially to be mindful of your behaviors, as the only way to keep your children safe without a vaccine available to them is to practice that harm reduction and decrease your risk of disease transmission. Late last week, the CDC reauthorized the use of the Johnson & Johnson vaccine for adults over 18. This came after reports of adverse events following the Johnson & Johnson vaccine administration that suggested an increased risk of a rare adverse event called thrombosis with thrombocytopenia syndrome, or blood clots occurring in different vessels throughout the body. A review of all the available data by the CDC and FDA at this time shows that the Johnson & Johnson vaccine's known and potential benefits outweigh its known and potential risks. However, women younger than 50 years old should be aware of this rare but increased risk of this adverse event. The CDC and FDA will monitor the safety of all COVID-19 vaccines, and we will continue to inform residents should any changes arise. Please be safe, Baltimore. Get vaccinated as soon as you can. And in the meantime, continue to wash your hands, keep your distance, wear your mask, and please stay home if you aren't feeling well. Thank you.
Thank you, Dr. Jaraza. In Baltimore, as you heard, we are not out of the woods yet. This is not over. And while we are happy that 35% of Baltimoreans have received at least their first shot of the vaccine, we are nowhere near where we need to be. And we are certainly not in a place where any resident should be just walking around without a mask, letting up on washing your hands regularly, or acting recklessly, as we have seen happen far too often in the city. And we know the impact of that. And I think Dr. Jaraza hit on it too. These are life-saving measures, but also with younger people becoming sicker than in this round of COVID-19. And then in the first, we have to really consider how we move about the city in a safe fashion, because you do not want to be one of those people on the ventilator. You do not want to be one of those people who have long-haul symptoms from COVID-19 simply because you could not resist going out and being in a place in a way that was unsafe. Baltimore still has some of the strongest public health mandates in the state, and we're going to continue to need everyone to do their part. We will continue to operate in accordance with the public health guidance and working to reach our residents with the vaccine. As a reminder, you can register a vaccine at covax.baltimorecity.gov. That's covax.baltimorecity.gov to pre-register for a vaccine and be matched with an available appointment. And now, before we close today, I want to turn it over to Commissioner Harrison to address some of the senseless violence that we had this weekend. Mr. Commissioner.
Good afternoon, and thank you, Mr. Mayor. Over the weekend, members of our department have been working very aggressively and tirelessly in focusing on those responsible for violent crime in our city. In partnership with the United States Marshals, we arrested an individual wanted for a homicide that occurred on April 19th in the 700 block of Wood Barn. Officers also arrested 8 individuals for illegally carrying firearms and in possession of large amounts of drugs and illegal substances. Gun arrests are up 32% this year compared to the same time last year. And while we continue to work aggressively in pursuing those responsible for the violence in our city, this past Friday, the Baltimore City employee family experienced a senseless tragedy as 2 city sanitation workers were shot while on duty. One victim, 32-year-old Devon Mason, was pronounced deceased at a local hospital, while the other, a 38-year-old male, has since been released from the hospital. Investigators are working closely with the Department of Public Works in trying to determine why the workers were in this location, which we know was outside of their assigned area. Additionally, we know that the workers were in this location for some time prior to the shooting. So we are asking anyone who may have seen something or heard something or who knows something about what happened this Friday evening, please call police, or you can call anonymously to Crime Stoppers at 1-866-7-LOCK-UP. This incident happened in broad daylight, and while we have received some information from our community, we need much more to hold these people accountable and so we can bring justice to the families. Thank you.
Thank you, Mr. Commissioner, and thank you to the women and men of BPD who have been working tirelessly to bring individuals like the individual that we arrested for murder to justice. And now we'll take a few questions.
Thank you. This is for Mayor Scott as well as Dr. DeRaja about the COVID-19 restrictions. Mayor Scott, over the weekend, I think it was on Friday, you took your mask off a couple of times to talk to the media while you were outside. The CDC is expected to announce some updates on outdoor mask wearing. Can you talk about the science behind keeping the mask at all times mandate in place outside especially?
I figured this would be your question and it wouldn't be related to what we're talking about today, so I'll answer it, and Dr. D, you don't have to. As we said to you guys on Friday when you asked, we have not received any guidance from the CDC that says they're changing the mask mandate. We're going to continue to follow the guidance that we get from Dr. D and the individuals you see with us. It is very reckless for people to be talking about or asking about mask mandates or taking them away when we've lost that many people, over 900 people to COVID, and we see our numbers where they are today. We're going to follow the guidance given by these folks and given by the CDC when it comes out. We don't look into a crystal ball and see that they're going to change things. They change them when they announce them. Thank you. Next question. Anybody else?
I have one more.
Thank you, everybody.